Hi. My gardening got cut short because of a big thunderstorm, and my aunt asked me last night about varicose veins. Let's talk about them. I did a lot of research, and I'm going to tell her, so I might as well tell you as well. Um, Essentially, varicose veins are just the veins in your legs getting the valves don't work as well. They get kind of twisted and they bulge out, and they can be really uncomfortable. They can cause itching. They can cause pain and swelling, and people want to get something done about it. So they are different than spider veins. Spider veins are much smaller, those little tiny veins that are also close to the skin, but they're usually not painful, and they don't bulge out, and they're not uncomfortable like a varicose vein. Varicose veins are incredibly common, more so as you age, more so in female population. It runs in families for sure. People who sit or stand for long periods, this decreases the circulation. So you can get varicose veins more commonly if you're sitting or standing. Dog. And people who smoke also have a higher likelihood of varicose veins. So, like we said, they're really, really super common. About a third of adults have them. They usually are in the lower legs, but I've seen them up into the inner thighs, up into even the groin. I've seen pregnant women with really bad varicose veins of the inner thigh and even up to the vulva. They can be incredibly painful. Usually, if they're associated with pregnancy, they go away or at least really reduce after the pregnancy is over. Essentially, what causes them is a number of things. The hormones, the estrogen, causes the vessels to become a little more weak and leaky. The aging process in and of itself, excess weight, and increased pressure in the legs. Restrictive clothing, especially if you have a tight waistband, does not allow the blood flow to return. And then there's pressure inside the vein from long periods of sitting or standing. So how does the blood in your legs get back to your heart? The normal process is by walking and moving the legs. That movement actually causes a pressure, and that pressure pushes the blood back up to your heart. So if you have any kind of restriction or you don't do a lot of moving, that blood just sits there and bulges out the veins. Generally, your doctor would do an ultrasound and make sure that there's nothing there other than just the vein, no blood clots or anything like that. And then recommend some treatments. So prevention is what did they say? An ounce of prevention is worth a pound of cure. Varicose veins definitely fit that bill. Elevating your legs a couple times a day over the level of your waistband can help. Stockings. So some people wear these compression socks. They're pretty tight. You can even get a little more tight. These are just for the lower leg, and these are really tight. They really push the blood flow up. Those are recommended by vascular surgeons to prevent varicosities and venous insufficiency. I know for myself, when I started wearing the compression hose after a 12-hour day on the labor floor running around, I used to get home, and there was one time where I actually almost fell down getting out of the car. I started wearing the compression hose. The swelling, I don't get swelling. They're so tight, it can't swell. And it helps push the blood back up and feels much more comfortable. They do recommend, if you can go all the way up to the waist and use supportive hose, that's even better. That for me is very uncomfortable. And I can't get into we're on the labor floor, I get in and out of the bathroom really fast. Can't do it with those tight hose. So I like just the lower, but it's working really well. And then if prevention is not enough, or that doesn't take away the painful swelling, itching, burning, there are treatments that you can use. Back in the day, they had essentially they would remove those veins. They would put you under general anesthesia and literally take the vein out. And most people with that didn't have a lot of return, but even with that, you can have varicose veins coming back. So they got much less invasive, and started with injecting. They have multiple different agents that they use to inject the vein, and it basically scars that tissue down. Some are like a really intense salt solution. Some are sclerosing foams or gels to help close that off and scar it down. Okay. Some of the newer modalities is using either laser or like a really high frequency ultrasound, and they put a little catheter into the vein. They go up, essentially they're heating the vein, and the heat causes the scar tissue to close that vein down and get rid of it. There's also a new technique where they do almost like a miniature removal of the vein, where they take little micro incisions and get each side of the vein, and it's much smaller than those invasive therapies from years ago. From what I can see, when I did a literature review, is that about the mid 2000s is when they got much better with the minimally invasive stuff, and really instead of putting people under and doing these big vein strippings, got really into the smaller surgeries. They seem to work. There's not a lot of information, not a lot of recent studies. I think it's pretty well established that they work pretty well, that they last a reasonable amount of time, that there are downsides, that some people can have the varicose veins come back, that what they call recanalized, meaning they opened back up. There is also some minor risks and some minor discomforts that you would certainly speak with a vascular surgeon about. Being an OBGYN, I'm not certainly not in that realm. But I hope this information has been helpful for you. And don't forget, wear your stockings.